Okay, so clinical micro skills are really just simple and straightforward skills that we can use in counseling. They really don't need a lot of explanation, but we'll go through the list. The first we have is active listening, which is just really being completely focused on what the client is saying, actively involved and showing empathy. So the client should not feel that you are bored by the conversation or distracted or disinterested. Body gestures. Be aware of yours and your client's body language. Body language is quite important, verbal and non-verbal communication, and body language can influence up to 80% of communication. Chronemics, be accurate regarding time, location, and recall. You want to be very aware of the sequence of events that the client has described so that you can use that for your reference when you're wanting to give feedback. Clarification statements. State what you think the client is saying at the end of what they're saying, just to keep it simpler and to the point. So if they've given you a long story about something that's happened to them at work, you can then make a clarification statement at the end by saying, well, okay, so basically what you're trying to tell me is you're very angry with your boss because the way he treated you brought up a previous situation that you had in another job scenario a couple of years ago, for example. Conflict avoidance. It's not really necessary that we always agree with our clients, that's fine, but we want to try and avoid arguing and debate. It's not useful, and once it reaches a certain point where you know it's going nowhere, it's sometimes better to just end the discussion and let the client go away, think about and absorb what has been said, and then come back at a later stage and you can readdress. Congruence, stay in tune with your own intentions and motivations and make sure that this is in sync with what you're saying and your body language. Your client should almost find you predictable in that they know what to expect from you, you're always congruent. Consequence questions, ask your clients if they understand what might likely happen if they act on a certain behavior or they make a certain decision. As especially with addicts, they don't really consider consequences. Very impulsive and compulsive, so sometimes it's useful for us to point that out and maybe play that movie through and see if they're aware. Contextual listening, listen for the context and details and how these events might impact your client, especially on a cognitive and emotional level. Emotional filter, be aware of your own emotions in counseling. As once you start to become emotionally involved in the counseling session, it's then going to affect how rational your feedback is going to be, and overall how effective you're going to be in that counseling situation. Empathy we've already discussed in a lot of detail. It's about being genuinely concerned about your clients, showing them that you are considerate of their well-being and that you are non-judgmental in the things that have gone on for them and are really there to help. Encouraging gestures, supportive statements that you can make that just help the client to continue to share, especially about topics they find difficult or stressful or uncomfortable. That can be simply as saying things like, well done, took a lot of courage for you to say that, or please continue. Just makes them feel a little more motivated to open up a little bit more. Eye contact, always maintain eye contact with your clients. In most cultures, we feel that if a person talks to you and with the eyes downcast, that they're hiding something or that they're being disrespectful and so on. So it's important for us to maintain eye contact. However, in some cultures, direct eye contact can be perceived as threatening or almost offensive. So just be aware if you're dealing with somebody who's from a different cultural background that you're aware of that kind of thing. Favorite phrases, and that's really just where you take note of some of the favorite phrases that your client uses and use some of them yourself. Frame of reference, ascertain what the client's point of view is. Frame of reference really is developed over time by events and situations we go through and traumas that will have the client seeing something in a particular way, or not just a situation but a person in a particular way. So we need to ascertain what their frame of reference is so that we can better help them through a situation by seeing how much of what they're seeing is real and how much of it isn't, and whether their frame of reference is correct. Gender and cultural differences. We just, I suppose, if you're staying in an area where you're going to be counseling people from certain cultures, be aware of those cultures. Maybe do some research into those cultures so that you know what their belief systems are and what their mannerisms are, and that you won't be doing anything in your counseling that might be offensive. Okay, generalizing. Clients, especially addicts, like to generalize because it just keeps them away from the really uncomfortable issues and situations in their lives. So try to listen out for when they're saying things like, yes, my drinking and using was really out of control and it's caused me a lot of problems in my life, and I feel that I've really hurt my family and my children. You could then be getting more to the point by saying, okay, well, how do you feel your drinking and using has affected your life negatively? What brought you to that conclusion? How do you feel you've hurt your family and your children? So getting more to the point. Using I language, that helps the client take responsibility for their own feelings and thoughts and actions, as we've discussed before. So instead of saying things like, we take a lot of drugs and we do this, saying I, speak for yourself, take responsibility. Inferences. Evaluate the difference between the client's words and their actions. Is it congruent? If the client's saying that I'm very serious about my recovery and I will not do anything that might be detrimental, and yet they've gone clubbing with their friends over the weekend, then you need to look out for that. Innocent probes, which is really basic counseling. That's just ensuring the client that you are paying attention by just saying small things here and there, helping them to continue and continue to talk. So just simple things like saying I see, or I understand where you're coming from, or please continue, that kind of thing. Okay, justifying questions. Ask questions in a non-judgmental manner, just to sometimes point out the inconsistencies in what the client is saying. It also just shows them that you are paying attention and that you are still tracking the conversation. Mirroring is where we use similar body language, gestures, movements, posture, just to help the client to feel a little bit more relaxed and comfortable around you. Non-attention is where we try to ignore offensive or abusive type of comments or behaviors. You can do this either by looking away, not giving them attention, or sometimes even ending the session, as we definitely don't want to reinforce or enable that kind of behavior. Observe proximities. It's believed that it's quite important how you place yourself across from your client. So what is suggested is to be about 4 to 6 feet away and then facing at a 45-degree angle. And this is because if you're facing the client head on, it can be quite intimidating, and so when the client feels uncomfortable, they can look away from you by looking ahead. Open-ended questions, especially in the beginning of counseling, we want to ask as many open-ended questions as we can because we want the client to talk. We want them to give us as much information as possible so that we can start to understand their frame of reference. We don't want them answering with simple yes or no answers, as that doesn't really help us much. Overcoming deflection. Help the clients to address issues instead of moving away from them, especially when they become painful or uncomfortable. Clients will use defense mechanisms like humor, making a joke out of the situation. Sometimes they'll try to change topic, or maybe even answer your question with questions. The second thing to look at is their non-verbal communication congruent with verbal communication. Are they telling you one thing, but the look on their face or their body language is suggesting something else? Positive asset statement is just simply where we frankly and honestly point out their positive assets and qualities. Positive regard. Maintain consistent non-judgmental caring no matter what the client decides they want to do or what action they decide to take. Reality congruence, and that's where we're noting if the client's views are kind of based in reality or not. What we're doing as counselors, especially in addiction counseling, is we're trying to weigh up the evidence that the client has given us with their irrational belief system. Reflecting, which is where we're just repeating the key concepts presented by them, shows them that we are paying attention once again, and also just encourages them to disclose more information. Reframing, provide the clients with another more positive outlook on the current situation. As we've spoken about before in techniques, exploring what some of the positive outcomes might be to the situation that they're going through rather than looking at it from a negative point of view. Selective attention, asking a question to get the client back on track is really what that is about. Clients will sometimes waffle on in different directions that might go off topic, so if you ask a question about the topic that you're originally discussing, it brings them back on track. Shadowing, which is really just when we repeat what the client is saying back to them using their own words. Summarizing, it's reviewing what the client has said to just show them that they are being properly heard and that we're understanding what they're saying. Silence, be calm and patient, sometimes in those quiet spaces, especially when you're discussing something that is quite emotionally painful for the clients. They might start to become tearful, might start to cry. Sometimes it's quite useful to just pause and be quiet in those moments to let them stay with the feeling. Validating, making a clear statement that you understand what the client is saying, what their situation is and their views. Voice tone, matching the client's speech and the tone of speech, the volume, the timbre with the clients, again, also just makes them feel more comfortable, but when appropriate. Values invasion, and that's just where it's important that we're very aware of our own belief systems and our own values, and that we don't try to impose those on the clients. We need to stay neutral. Vocabulary, speak at the client's level, be aware of regionalisms and colloquialisms. And then lastly, just warm regard, genuinely showing a non-judgmental, accepting positive regard for the client through thought and deed.